Let's get started on the first presentation. It's regarding CMS audits. We have with us today from Neosho Memorial Regional Medical Center, Wendy Brazel, got it right, Wendy Brazel, and Gretchen Keller. My understanding is that they've gone through a CMS audit. They have. So if y'all will bear with me for a moment, I will read to you their bios. Wendy Brazel is the compliance officer at Neosho Memorial Regional Medical Center. In addition to her role as a compliance officer, Ms. Brazel is a member of the senior management team and heads the Administrative Services Department, which oversees compliance, quality, and physician clinics. Ms. Brazel received her BA and JD degrees from the University of Kansas. She is a member of, I paused there because my daughter goes to K-State. Yeah, well, almost a national championship and almost a Heisman. Almost. She is a member of an American Health Lawyers Association, so we have an attorney with us here, so careful. The Healthcare Compliance Association and the Kansas Bar Association. She also serves on the Kansas Hospital Association Council for Healthcare Delivery. Gretchen is the Director of Health Information Management and Information Systems at Neosho Memorial Regional Medical Center. Ms. Keller received her BS in Health Information Management from the University of Kansas also. I don't know why they should go there, but okay. She is a member of HIPAA. And at this time, I'll turn over the podium to you ladies, and thank you.
Thank you. Thank you so much for inviting us, everyone. Can you hear me all right? We are going, whoops. Sorry. We're going to talk about our HIPAA audit. This was not a meaningful use audit. It was one of the HIPAA audits that the government is doing. And we were chosen out of all the hospitals in the country to be one of the first, turns out to be 115 hospitals they did during the pilot project. But as you probably already know, the ARRA requires HHS to audit hospitals and other providers for HIPAA compliance. And the pilot program began in 2011 and concluded just end of this last year. And they were supposed to perform up to 150 audits. I believe they ended up doing 115, like I said. And they engaged the accounting firm of KPMG to do these audits. So we are a critical access hospital in Chanute, so we're about an hour and a half, 2 hours south of here. You know, small hospital. Really, honestly, I think I jinxed us by one day I was supposed to be watching a webinar about OCR audits, and you know how it is when you're watching a webinar and you're not actually listening to the webinar that carefully, because I was thinking, oh, we'll never get audited. I don't need to worry about this. And then like the next week, we got the letter from KPMG. So it could happen to anyone. And we are not professing to be experts on HIPAA, privacy or security, but we are here to tell you about our experience, what they asked for, and maybe some ways that you can prepare. The audits are supposed to be a compliance tool and not an investigation. So they claim they're random. We hadn't had any complaints that we know about, so I'm assuming that it was a random selection. I think they were trying to find different entities all over the country, different types of providers, different size. So they said it was a random choice, and I guess that's what it was. They will, if they find something very serious, they will possibly go deeper and do an investigation or refer it on to OCR, but that didn't happen to us, luckily. And the objective of these is to improve covered entity compliance with HIPAA, and then they're going to publicize their results and maybe give some best practices. You know, they're going to find out where the weaknesses are in covered entities and try to help us all comply with HIPAA. The process is that you get a letter from KPMG, which was interesting because our letter happened to come to our risk manager I don't know why, but she happened to be on vacation. This all happened this last summer. And so it sat in her office for a little while. And, you know, it was from KPMG, so it wasn't like a government letter, and you didn't really just say, oh my gosh, I got to open that. So, and we're a small facility, so it sat on her desk for a little while. And finally, she gets back from vacation and opens it. And they have a document request that you're supposed to comply with in 15 days. They did give us an extension because of what happened with the letter. So we were able to get another week or two to get our documents in. And then after you send them the documents, they come on site and do their field work. And you have a potential of them being there a week. Now, they were not in our facility for a week. They were there for 3 days. But there are 3 of them. At least there were in our audit. And we're, like I said, a small facility. So, and then they are supposed to draft their potential findings and send them back to you and give you 10 days to respond, and then have a final audit report. Now, we haven't even gotten all that stuff yet. And our audit was in July. So we've got a letter from them in November asking us to have our CEO sign the management representation letter, similar to what you might sign when you have your financial audits. And that was November, and we haven't heard back. They do an exit conference with you and kind of tell you if they've had any findings. They told us they really didn't have any findings at our facility, but I can't say that is for sure because I haven't heard that yet from the OCR. So we will see. As far as the document request, they want a lot of information about the covered entity. So they want to know who to contact. They want to know if you've had any previous audits. They want to know how you use PHI. Do you disclose it for research or fundraising? And then they have an attachment with a lot of documents that they want you to send in ahead of time. These are all things you should probably have already. They want to know a lot about you. They want to know how you developed your HIPAA policies. If you used, some canned policies that you bought from somebody, they want to know who you got them from. So they want to know that kind of information. They want to know how big you are, how many visits you have, how many beds, the number of clinicians you have, do you have an EMR, and your revenue. So all of that is kind of basic information. They want to know your contact information, and like I said, they want to know any guidance or reference material that you use to develop your policies. They want your notice of privacy practices and your documentation of training of your employees. Then they want to see all your HIPAA policies and procedures. And all of this, by the way, is on the OCR's website. The Audit Protocol is on there for privacy and for security. And so it's not a big secret what they're looking for. Gretchen will get in more to the security side. There are a few things on the security side that maybe are not set out in the protocol, but the stuff that they want in the document request is all on the audit protocol, and it's policies and procedures that everyone should already have. The thing that you need to make sure is that you've updated your policies and procedures, particularly for high tech and a breach notification and all those kind of things. But they want all your privacy policies, all your administrative, technical, and physical safeguards for all forms of PHI that you deal with, how you handle complaints, and they will ask you about, when they get to the facility, they'll ask you if you've had complaints and how you handled them. If you've had to discipline any employees over privacy violations, they want to hear about that. And any breaches you've had, how did you mitigate those? What were the disciplinary actions that you took? And then they want documentation on a lot of privacy issues. So right to request privacy information, right to request privacy protection. They want to see all these forms that you have in your health information department for people to request information. They want to know access of individuals to PHI, and if you've had to deny that, why. Anyone asked to amend their medical record or their PHI, and how did you deal with that? How do you account for your disclosures? All the administrative requirements, and then your use and disclosure policy. And under use and disclosures, they had a lot of specific questions about different policies. So they want to see all the policies that you see up here on the slide. Deceased individuals, your confidential communication. They want to see some of your business associate agreements. They will specifically ask for your EHR vendor agreement, your clearinghouse maybe, and then another business associate agreement that you choose they'll want to see. Treatment, payment, and operations policy, your consent requirements, your judicial and administrative requirements, and how you de-identify or re-identify your PHI, how you deal with restrictions, and how you verify identities. So these are all policies. They want to see all these policies. So you're going to send all of this stuff to them ahead of time. And then Gretchen is going to talk a little bit about what they asked for as far as security and what documents they wanted there.
We had a short time frame to get this information in, and then since they did a little favor for us to give the extension, we did a little favor for them. And the lady who got us the extension called us like a week later and said, hey, can they come on Monday? And usually you're supposed to have 30 days, or they usually call you and schedule it so you know when they're coming. And so we were like, oh, well, okay. Bring them on. And surely they haven't had time to go through all of our policies and procedures. And we just sent it in, but they know them from like the back of their hand when they come in your facility. So all this documentation that you're gonna send them, know it, because they're gonna have questions ready for you, and they've gone through it all. But for the security, this was the piece I was really worried about. I took over IT a few years back, so security and the IT world is still very new to me. So I was super worried about this. I didn't think we were going to be able to pass it. They didn't find anything for us, or so they say. We haven't got the final word, but this is kind of the path we took. So they went into your contact information. Again, any guidance that you've gotten if you had canned policies. They were very vocal about they don't like canned policies. They wanted policies that looked like they were your policies. They wanted to see your risk assessment. We had to send that in with the documents. That was the main thing that they were looking for. They wanted it entity level specific, all systems that house PHI and all your risk assessment procedures to go along with it. We had just finished our risk assessment because we were getting ready to start our 90 days for meaningful use, our attestation. And so we were lucky that we got done. And then they want to see the organizational chart. Oops, wrong way. Any kind of plans that you have, your security incident management plans, disaster recovery plans. And they wanted to see if you do have a disaster recovery plan, they wanted their most recent exercise documentation that you had. And we just so happened one day had one of our systems go down, and we thought, we better write that up because we don't know with a meaningful use, and if they come in and audit us for that, we need to have some of this. And we just we didn't even know a format, and we just documented in a little paragraph what happened, what we did, how we followed our plan. And again, someone was watching over us because that was one of the things they wanted. They wanted a list of role-based access. So each system that you had, they wanted to see the job levels and the level of PHI access by person. And so out of each of our systems, we did a user access listing and what level of security that they had. And then they wanted a list of all the new hires that we've had for the past year. And what they were looking for here was, do you have some sort of tool for your new hires on what kind of access they get? So some of the policies and procedures on the security side that they wanted was our access control, our data protection, our acceptable use, any kind of workstation security or workforce, HR security. So they wanted to see in the HR records, did we have our forms and what security that they had on the computer systems, and then any sanction policy and procedure. They also wanted to see the physical security policy, any kind of encryption policies, our backup and recovery procedures, our data destruction and reuse procedures, and any kind of user authentication that we had. Then they went on into a new section with high tech, and they wanted to see how our breach notification process and then our risk assessment. So when they came on site, they wanted, you get a conference call before they come, and they go, they have the 3 auditors that came to our facility on the call, and they just kind of wanted to tell us how the process was going to go. They wanted a room or an office to themselves that had internet access. Lucky for us, our internet access went down that day. I was like, oh, what else could go wrong? The day that they told me this letter had set for a while and that it was all due to that day, I was like, you've got to be kidding me. We just had gone up on CPOE. I was starting my 90 days. Docs were just like, I was not the fan favorite at the hospital. And then the day they walk in, you know, it was like a week later, we weren't ready. We were like, oh, well. And then the internet goes down on them. So it did come up, you know, half a day later, but it was like, what else could go my way? They come in and do an entrance conference, and it's just a slide presentation of what they're here for, that it's a compliance educational type event, but they make it well known that if they find anything, they will open it up to a full audit. We did a walkthrough of the facility with them. We put them up in an office that was, we all knew where they were at all times. We were worried that they'd be wandering about, but they really didn't. We took them on the walkthrough, and they were still a little green. They wanted us to help them as much as we wanted them to help us. They had a lot of questions about how things happened. They would get stuck on words that like intake forms. We don't do intake forms. We have an admission process, but they were stuck on that word. So you kind of had to teach them, well, this intake forms, yes, but this is what this means here. It's the same thing. So you kind of had to guide them a little bit, but we did take them on the tour, and they were very observant. We took them through all the units, all the places that they wanted to see. The first thing they wanted to see was the HIM department and the coding department, if they were separate. We told them we'd get there, but we're going to start here. But they kept saying, well, now where's the HIM department? I'm like, we're going. But they were very observant on the nursing units. So they were asking, when do we have computers in all the rooms? We had computers at all the desks. And I tell you, every unit we went to, there was no one at the desk. And so I was like, great. So they wanted to know, when did my screensavers come on and when did I lock out? And so I was like going back through my head, is there a standard? What's the time limit? Am I going to tell them wrong? And so I said, well, the screensaver comes on within a minute, and the screens lock out based on where the computers are. It's in a high traffic area. We lock them out within 2 to 5 minutes. And they just looked at me, and I thought, oh my God, I just got our first write-up. And they're like, well, no, that's fine. We just wouldn't want to see it any longer than that. So it's not, I think they were gathering a lot of information to take back, and I think we're going to see a lot more guidance on how many minutes to this, that in the future. But we do lock ours out pretty quickly, which doesn't make clinical staff too happy, but it made them very happy. Through the walkthrough, they were looking at security, were doors locked. We do have keypad entries on some of our entrances to HIM, and they were very happy about that. They did go in my coding department, and my coders are behind cubicles, and they all came out to the center aisle to meet them all, and they just stood there and talked to them. And it was more of a, I'm talking to you, but I'm looking around to see what patient information I can see. And luckily, my coder that was right by the door, she did have the screens that you can't see anything unless you're right on it, and they did make a comment about that. So they were looking around, and they would stand and just talk to see what could they see while I'm standing here. Can you think of anything else? They did, screens and locking were big. They made sure our server room was locked. Any place where we had any of our computer systems, they wanted to see to make sure it was behind a locked door. And who had access. Keypads, if they want to know, well, do those get changed if someone gets fired? Who had key access? And so that you just, you talked about it. After we did the walkthrough, they wanted to start the interviews, and they went to meet. They don't care where you start, privacy or security. Lucky me, I get both. So we just went into the room, and Wendy was with me, and our risk manager was with me. And you can bring whoever you want to the interviews. They were wanting to know if I wanted any of my release of information staff to come. And I'm like, no, I think we need to see what's going on first. So it was just us three. And they just started asking questions. They have all your information, so they know how you practice. And so they're just verifying that you know what you handed to them. They had more requests. And as they asked the questions, these were where the requests came from. They wanted to see screenshots of our admission screens. They were really looking for the notice of privacy and how do we know when you give it, and if you change your notice of privacy, how you know if you've given them the most current version. Now they are very green. They were two forensic accountants, and one guy who said he was in IT at a hospital, but he did the privacy interview, which I didn't understand because I was scared to death. And the two forensic accountants did the security part of it. So I'm not quite sure how that all mapped out, but so they don't really have a hospital background. So on my screenshots and on the stuff they wanted to give back to you, I did a lot of screenshots with captions, because they want you screenshots at the admission screens, but when you hand them back, they don't know what they're looking at. So I had to take them through. This is where you do the demographic information. This is where you do the, why they're here, the visit information. This is where we give the notice of privacy practice. If there's an X in this box, it says it's got, I had to really caption the screen so because they're just taking this back and they're not going to remember what you told them about that screen. So I did a lot of captioning of the screenshots that I gave them. They wanted examples of an signed acknowledgement. I gave them current, and then they wanted like one from 6 months ago. And they want the actual screen print in the computer, the actual copy that the patient signed, and then they want a face sheet to go along with it to prove. You're really just proving your practice. They wanted a release of information form, any kind of change of communication form, and then they wanted examples of that. Copies of our training roster. They want to know how you train your people. We do a lot of hospital-wide training, but I also do a lot of HIM training on HIPAA, and so they wanted to see what did I use. They wanted the curriculum that I used, and we used an online HIPAA refresher course, and so they wanted me to get online and do screen prints of everything that course went over. And then they wanted any kind of documentation of a breach assessment. They ask you a lot of questions. Have you ever had a breach? And
then they ask you, because we hadn't had a breach, and so they said, have you had anything that you thought might have been a breach? And we had a situation where we had to kind of go through that analysis, but we decided it wasn't a breach, but we didn't have documentation of that. We'd had a conversation with HR and with the unit manager, and it was a Facebook posting, and we'd had a conversation with the employee about it, but we didn't think it was an actual breach because we didn't think there was enough information. And as it turned out, they didn't give us a recommendation on that because they didn't think it was a breach, and therefore we didn't have to, do this. But they did say a best practice is to make sure that's all documented. So if you have a situation where you're thinking, this could be a breach, are we going to have to, tell anyone about this? You need to just document that in writing in some kind of a memo. They don't really care what it is, just a
Yeah.
written.
They just want to know, how did you come to that conclusion?
Yeah.
And so what we had to come up with was we had to pull that employee's file and show that we did talk to them. We could kind of piece it together for them, but it wasn't in a pretty picture that they think that it probably should have been in. They wanted to see some executed authorization, so a court order, so release of information. They wanted to see any kind of court order requests we've had. We copied the court order. We copied then on the screens in our release of information application that patient and what we released and how we released it, when we released it, and when we got the request, and was it in the time frame. And so I had to take them through all those screenshots and all the fields and what they meant to prove that we complied and we did what we were supposed to do. A deceased request and how we do that, and did we follow our policy, and was it the executor of this state, or was it the oldest child? You had to kind of prove how you did that release. And then they wanted one just using our own authorization form, and did it meet all the criteria, and then what did we release to that patient. They wanted to see screenshots of role-based access. So what I gave them was like a nurse aide versus a nurse. They want to see, they don't want everyone to have access to everything. They wanted to see, how do you crank it down by job title? And so I just gave a screenshot of what a nurse aide can see on the EMR and what a nurse can see on the EMR. Our executed business associate agreements, they wanted our vendor, our clearinghouse, and then they said to pick one. For security, when we started that conversation, they wanted to see our access form. And I think what they did was they took our new hire list, and then they wanted to see, did we have an access form for each of those new hires? They wanted to see that all of our systems had a login screen. So they didn't care what system, so I just went and for our med administration system, for our just billing system, we just did various screenshots so they could see that there is a login screen for each. Our contingency plan, they wanted a copy of it, and then they just had you talk about it a little bit. The documentation of a recent disaster plan, although I sent this in with the documents, they wanted me to produce it again. Screenshots of inventory. They want to know how we kept track of our inventory of all of our computers, and did we know where laptops were, who had what, and how we did that. So we did screenshots of all that. And evidence of how we destroyed our media or our hardware, and we had just had a few computers come out of service, and we had a policy written, and we didn't know if it was good enough, but we showed how we destroy, and we attached pictures, and so they liked that policy, that we showed them how we did it in our policy. And then we had a log, and we just, I had just hired someone in to help me with the risk assessment and all this, and she's very detail-oriented documentation, and so she had a log started of when we destroyed some hard drives. Thank the Lord, because they wanted to see it. And it just really had one entry because we had just started all this, because when I got IT, we had nothing. So we had just started getting all these policies started. So a lot of these were very new policies, and they were okay with that. But I had something, and we were following it. And then they wanted some screenshots of our backup confirmations of our systems. And they didn't care what systems. I think some of them I gave them was like Kronos, that we just did a backup. They were okay as long as they could have proof that we did backups. And they wanted consecutive days. And we did our HIS system, but I just threw in some non-systems in there. Any kind of validation of encryption, if you're sending data, we have our vendor host some of our systems, and so they wanted to see how we were connected and at what points was stuff encrypted. So our vendor just sent us a picture of how we're connected and where the encryption took place. And then our clearinghouse website, they wanted to see the secure website that we used when we uploaded claims. And then VPN screenshots, they wanted to see, again, that the hashing algorithms, the encryption. They just wanted proof of that. And then the audit logs, make sure you have your audit logs and all your systems turned on. And if your policy says that you are auditing them, make sure you have proof of that. They wanted screenshots of our audit logs and they didn't care what system. So I just used our main system and our pharmacy system. And they wanted it by user and they wanted it by transaction. I told them, these logs are huge. They've been running forever. I'm not printing them out. And they are like, that's fine. We just want screenshots. So I did a few screenshots by user, by transaction, to prove that we have them turned on. And so then they want to know, are you auditing those? And we had just started auditing them, just going through the preparation for meaningful use. And so I had a spreadsheet, and they said we were the first ones that they'd seen this. So it was just one that we made up. And since we do random audits, I just did random audits. If your policy says you're going to do it quarterly, they were looking for it to be done quarterly. If you said you were going to do it monthly, they were looking to see that you had an audit monthly. How I've done this, and I don't know if it's right or wrong, about each quarter, I will pick a system, and I go in and I run the log for the day that I'm actually doing it. And for the one I turned into them was of our main medical record. I picked the first 5 people that came up on the log, and I verified their access. So I had a nurse, and I verified she was on that day, and then I found out what patients were assigned to her, and then I looked at her access and where she went. And then I just wrote my findings. She did not venture out of her patients that she was assigned to, no problem seen. I had a coder that popped up on my list, and so I verified what she was an outpatient coder. I verified what outpatient day she was coding that day, and then I went in to see the admissions for that day. Who was she getting into? What did she code? And then I just reported my findings. So I kind of had something for them to give them. So that was a good thing for them. They wanted to see that you were actually looking at the logs and seeing are people getting in the right places. They wanted to see, we have MS4 with Siemens, so they wanted to see our role-based screens again. So for this one, I did an insurance biller versus an admissions clerk, and I showed them the differences there by the menus that they did. And then they wanted to see some examples and screenshots of any kind of checksum functionality, just making sure that things were lining up correctly and that you had some kind of checksum functionality. So I showed them examples within the interfaces of how our order numbers have to have it, how our account numbers have to have it, and just wrote a little synopsis so they understood what they were looking at.
And so that was pretty much the whole audit. Like I said, they were actually there for really 2.5 days. They left in the afternoon of the 3rd day. I think we were kind of lucky that it was July and it was about 110 degrees where we were, and they were from Chicago, LA, and Washington D.C. So they're in Chanute, Kansas, and I don't think they want to be there forever. They're young, and they're
very
so
young.
so that was kind of a break for us. So they didn't stay any longer than they had to, but I think the main point of what Gretchen said is that you have to be able to show that you are doing what's in your policies and procedures. So that would be the main takeaway is, I'm sure everybody has policies and procedures by now for HIPAA, but the question is, are you really doing what your policies and procedures say? So especially if you got them from someone else, which I think everybody did. I mean, nobody just created them from scratch, but make sure you know what's in them and that you're doing them. And then as far as these results, these are the results that OCR put out after, I believe, the first 20 audits. So I don't think they've put out another one of these after all the audits are finished. I'm sure they will sometime this year. But the main things they were finding were people didn't do a risk analysis. And of course, if you're going for meaningful use, you've done some kind of risk analysis. So hopefully a lot of people already have that in place. The user access, just how you grant or modify that, and can you show your procedures for those. Incident response, like Gretchen talked about, we just happened to get lucky on that one, that we had that written up. Your media reuse and destruction, that was important. Encryption, user activity monitoring, like Gretchen said, a lot of people are running audit logs all the time, but they don't look at them because they're voluminous, and who really has time to do that? But they want you to do something with those logs, not just run them. Authentication and integrity, and then physical access, just locking of doors and that kind of thing, having the filters over your screen so that they're not easily seen by people walking by. And then more information. This is the web address for the audit protocol. So all of this is on the website, OCR's website. Really, it kind of goes through all the elements because they had to sit down with KPMG and tell them this is what we want you to look for. And that's what they're doing. They spend a lot of time. One of the auditors pretty much spends the whole time in the office putting everything in his computer and getting ready to do a report. So they are going through that audit protocol. Now, I think when they're in a larger facility or a system, they will, they'll kind of go down a rabbit trail. If they find something they're interested in, they will really hit hard on that particular item. For us, it was more generalized because we're small and they could pretty much look at everything. The other thing is when they are in your facility, they don't want any paper. They want everything transmitted to them via email. So
There's a lot of scanning.
they will not take anything out that is paper. And you can redact patient names and do whatever you need to do that way, but they want it all via email.
And they really liked that we had everything organized for them. So when we sent everything in, it was all tabbed. It was all in a, ready, step 1, step 2, step 3. When they got here, they had everything, and they kept saying, "You've made our job so much easier. You don't know how much we appreciate this." And I think they said that like 100 times. So
I think hospitals are used to that because when you get surveyed by anyone, you try to make it as easy for them as possible. So that's just something you learn, but other entities can also learn from that and try to be organized. Do you all have any questions of us about the audit process or what happened to us? Anything? All right. Well, thank you so much for having us.
Thank you. We are way ahead of schedule. Wendy and Gretchen do have to go back to Chanute, so we're going to take this opportunity. If you guys have any questions about audits and what they've experienced, allow them to answer those questions before they leave. And I have a microphone to help for that if there are any questions in the audience at this time. Audits are such an exciting topic. Okay. Well, I do have one question. If you had it to do all over again, or in your preparations for meaningful use 2, and what other audits might come from meaningful use, what would you have done differently other than a few of the lucky things that you were able to do? What did you learn that you would change in your processes at your hospital?
You get so involved in the day-to-day and making, I think I would have dived deeper into knowing the policies. I knew them, but I hadn't looked at them in a while, although we do a yearly update. I really know your policies is the big key, and your procedures, and that they're doing it that way, because they'll come and watch you. They went to our admissions department and watched an admission, and so you were just hoping that that admission clerk did it right, because they were watching through the whole thing.
And the other thing is just to have everything documented, you know, like a disciplinary action or a possible disciplinary action or those kind of things. Sometimes you spend a lot of time talking about something, but you don't think to write down your thought process of why you did something. The same thing with, you know, why is this a breach or not, or just all those conclusions that you come to. It's kind of like when you looked at the HIPAA standards to begin with and those things that were addressable, and how did you document, you know, what you decided to do as far as HIPAA security and those kind of things. So just have documentation of your thought process.
Okay. Questions in the back? Great.
I probably don't need that thing. Did they ask you about how you secure your mobile devices?
They asked us, and we do a, you know, VPN connection, so we did not have any, there's no data on the mobile devices. We just are laptops. We don't do phones or anything like that. They did ask us, so we just told them that there's nothing living on the laptop, so if it, and they were fine with it. They did ask us if that kind of led into the inventory and how we knew who had what mobile device, and we just had to verify. A lot of it, they would just ask questions, and then on some things they didn't want proof of it, but they didn't ask for any kind of, we didn't have any laptops that, we didn't have anything in a policy that saying our mobile devices are encrypted, because if, then they would have said, okay, we want to see that. We want to see that, but, so that's all they asked.
We have a question back there.
Yes. How did you prepare the hospital staff for the audit? What kind of communications did you have with them? How much did you tell them? How much didn't you tell them? How were they prepared?
We told them everything. I mean, we didn't know if it would be like a joint commission survey where they were really out and talking to people, or what it was going to be like. So we, via email, all user emails, just that they were coming, and, you know, please make sure you're taking care of patient information as you're always supposed to do. And then to the department managers, we gave, you know, more information and sent them some sort of test audit things we had where they could go through their department and kind of look for some, you know, obvious things.
We also had our risk manager.
Yeah, we walked around a lot. We walked around and looked for information. They really didn't go out, except for the building tour at the beginning. They didn't really talk to a lot of employees, but they did look around and they, you know, look at your screens and all that. But it wasn't like they were out every day trying to catch employees and see what they would say. It wasn't that kind of an audit.
No, they were really the gatherers of information. They were really, okay, now I need this, I need this. They go back and they work on their report. They were really big on, we want to get this report done because it's a huge report. They kept saying that, and they, when we had it to them within 10 or 15 minutes, they were like, oh, thank you, we can get this report done. So they were really stuck on getting the report done. So they weren't out walking around, and that's why they left a couple days early, was they were able to get everything that they needed and then just go work on the report at home. They wanted to go back home. So, back on the mobile devices, they did ask us if if our physicians texted. So if we don't control their phones or anything. We have just recently put in a texting application for them to use that's HIPAA compliant, but they do ask those type questions.
I have another question.
First, you guys have done a great job. I mean, I'm really impressed with how you manage this. And also the fact is, you've already done the meaningful use attestation and everything, and you probably did really help these guys. You probably spoiled them for some of the other places they're going to go. But that's great work. Question I have is with things like joint commission surveys, there are companies, I think Greeley is one that some of the systems I've worked with have used, where you can rent a survey team, and they'll come in and do a mock survey. Do you know if there's anyone who does mock surveys for this kind of audit, or does anyone know? Because, I mean, you got a free survey, so that worked out well for you, but most of the places I've been wouldn't, they'd like to know ahead of time.
Yeah.
I am sure there are. I don't know. I mean, there's probably people in this room who know vendors that would do that. We are managed by QHR, so you know they have people that would do that if we would have asked them, but we didn't really think this was going to happen to us, so we did not. I will tell you, if you go on the website and look at the audit protocol, you can kind of do your own little pre-audit.
That doesn't count though. You got to have a
Another set of eyes is always helpful, and you don't always see what's going on. But
And I was real worried on the security side. Like I said, that was where we weren't really practicing weak, but our documentation was weak, and so I was panicked.
yeah, she was panicked.
And it went okay.
Yeah.
They-
I think we were lucky we were one of the early ones. At the time, we
Yeah.
thought it was horrible, but honestly, they're going to know more. The more they do, the more they're going to know. And so
Yeah,
the later audits will
we
be
were like
worse.
one of their first hospitals. They
Yeah.
had just been to a place. They couldn't tell anybody where they were, and they're okay with us telling. They said that we could tell all we want, but they can't say anything about us. But we did get out of them that they had just come from a place that creates an app for a phone, and they were auditing them. So they were hitting different.
Yeah, the team we had not, I think we were their first hospital. They'd been to maybe a physician practice and then,
And they
the
were
software
upfront
company.
with that. They said, please help
So-
us through this, teach us. And so you kind of had to guide them through it.
I had a question. You mentioned that your coders were actually on site, but that's not that usual anymore. A lot of times they work from home, so I was wondering along the lines of the mobile, if they asked any questions about how you're securing the devices remotely. And I mean, people are working from home, so who's to say that family members can't see things and stuff like that?
We told them how like when managers, how they get in from home. And I didn't have to provide any policies. I might have had it in a few that they had already gotten, but I think if you document how you keep it secure, and if you do like audits of the home and make sure, or have them sign something, I think you're covered. As long as you have a way of proving security and that it's secure. We had one backup that was over in another building off-site, and they wanted to see all those places. And it was, like I said, 110 that week, and I said, okay, let's go, and they're like, it's not here. I said, no. And they're like, well, is it behind a locked door? And I said, yeah. Are you guys the only one that had the key? And I said, yeah. Then they were like, okay, we're not going over there. so, I mean, you could kind of talk them through, this is how we secure it, then we check on it, and I think they would be fine with that.
I was pleased to hear you talk about training, and they audited your training roster and new hire trainings, for instance. Could you talk a little more about how you staff the training, whether it's internal or contract or different processes, programs?
We use internal for general orientation and nursing orientation. We have an education coordinator that does that. So that kind of training is all internal. Now, we do also use some external computerized training for specific areas, like Gretchen uses it in HIM for specific things. But we have basically just sort of an internal training. I think it's scalable to your organization. So we're we have 350 employees. It's not like we're a system that has to train 2,000 people. So they're going to look at that. It's, you know, how, depending on the size of your organization, what do you need to do?
And so with the online, is it self-paced, self-administered?
Yeah, what we did, it was self-paced. I wasn't real excited about it, but my coder, or my HIM staff really wanted to go through it. They had found it, and I'm like, all right, we'll do it. It was real basic, but the auditors liked it. I think they are just looking at, are you keeping this in front of everybody's face? Are you teaching them that? And then they would look at the content, and if it hit most of the things, I think they were fine with it.
Any other questions?
Do we have any other questions?
All right. Well, Wendy and Gretchen,
Thank you all
very
so much.
And everybody, thanks. Safe travels back. All right, our next group is with the state of Kansas. We have Mary and Donna. If you want to come up front, we'll go ahead and get started. We are a little bit ahead of schedule, so I tell you what, why don't we take just a quick 5-minute break for anybody needs to take a quick personal break, but let's get started and try to stay on schedule.